Start. Yeah. So let's start with what are personality disorders. Now, personality disorders, right, are something that would inherently be present in the patient. It's not that it's been going on for like 2 weeks or 6 months or maybe a year. They would have them for the longest time that they can remember. And this here, I would say, is the most important point of personality disorders, that they're egosyntonic. That means the patients do not think that they have a problem. For them, it's just the way they are. Usually, people who have depression or patients who have anxiety, they tell you that, oh, I feel depressed or I feel anxious. But patients with personality disorder, they would tell you that there is nothing wrong with them. It's just the way they are. Now, there are three different clusters. So, cluster A, cluster B, cluster C. And you don't really need to remember all of these clusters, but you can kind of remember the classification. So, it helps better identify them. So, cluster A would be weird people, cluster B is wild, and cluster C is worried. Now, once again, you don't really need to remember all of these, even if you simply remember the personality disorders. That is what the USMLE will test you on. They won't really test you on which disorder belongs to which cluster. Okay. So now we have cluster A, and cluster A, as we said, was weird people. So cluster A has paranoid, schizoid, and schizotypal. Now, paranoid disorder. Usually, these people are pretty paranoid, and that just means that they're always worried about something. Usually, the type of worry that they have is that someone is trying to persecute them. That is the most common type of paranoid disorder or like paranoid delusion. Persecutory. That means, let's say, they would feel that there is some kind of cop who's trying to like spy on them or someone who is actively trying to put them in jail. Something similar. Additionally, one of the things, right, is this distrust, the accusatory or persecutory behavior. Along with that, this here I would say is the most important point. These patients have a profoundly cynical view of the world. And that just means that anything you tell them, even during an interview, they would be very skeptical about whatever you've told them. And that's what constitutes paranoid disorder. Next, we have schizoid and schizotypal. Now, there are three conditions, right? Because they have very similar names, it's very easy to kind of confuse them. Give me 1 second. There's a lot of noise on my end. Asavri. Sorry for that. So there are these three conditions, right? Schizoid, schizotypal, and schizophrenia. They all sound pretty much the same, but they're all very different. Now, patients with schizoid disorder or schizoid personality disorder, usually they'll be withdrawn and they'll be very alone. Patients with schizotypal, they would be similar to like someone with schizophrenia, but like a milder version. So they'll also have this magical thinking, but the difference is that these people only have magical thinking and they're not actively hallucinating or they don't have any active delusions. Additionally, these would be also this eccentric appearance. So think about them as the like conspiracy theorists who wear like tin foil hats. So that would be very classic of someone who has schizotypal disorder. And schizoid disorder would be someone who lives in their basement. They're very alone. They don't have any friends. And this is important. The reason why they don't have friends is because they don't desire company. That is very different from avoidant disorder because people with avoidant disorder, they would also be very alone. But the reason why people with avoidant disorder are alone is because people with avoidant disorder feel like they would be rejected by other people when they interact with them. So that's why they're alone. Compared to schizoid people, people with schizoid disorder, or schizoid personality disorder who are alone because of choice. Next, we have cluster B, and these people, they're wild in nature, as your first aid puts it. But a couple of interesting disorders here. So we have antisocial behavior disorder. Now, we've already learned about antisocial. Sorry, yeah, we've already learned about antisocial behavioral disorder when we talked about conduct and antisocial. Now, the difference is that people who are more than the age of 18, so anyone who was diagnosed with conduct disorder before the age of 18, and now they've kind of crossed the 18-year mark, that would be antisocial disorder. And the most important thing for antisocial disorder is that they would have at least one criminal offense. It doesn't need to be that they went to jail for this criminal offense, but that something they did during like their history or presentation was criminal in nature. So it doesn't have to be jail, but only criminal in nature. Then we have people with borderline personality disorder. Now, we talked about borderline a while back when we talked about ego defense mechanisms and specifically splitting. So, do you guys remember what splitting is?
All good or all bad, these people?
Yes. So, it's a very black and white.
Is it split personality?
No, so split personality is very different. Split personality or multiple personality disorder or dissociative identity disorder, they are very different from splitting. Now, splitting is an ego defense mechanism, and it's where the patient will view the world either black or white. There is no in between. Either everyone is an angel or everyone is, let's say, a demon. And they can switch
Okay.
between them very easily. So let's say the example I use is, let's say a patient was at the hospital and they asked a nurse for a glass of water, but the nurse said or like refused for a glass of water because they had other things that they were doing, maybe like an important procedure. So then the patient says that, oh, all nurses are very bad. They don't treat patients very well. And on the other hand, when the patient asked the doctor for a glass of water, the doctor gave her a glass of water, and then she just assumes that, oh, all doctors are very good. But then one extension would be that, let's say, after this interaction, she met with a psychiatrist, and the psychiatrist told her that she has borderline personality disorder. Patient got very offended, and then the patient started that all doctors are very bad because of that one small interaction. So see, they're switching between black and white very easily. There is nothing in between. Everyone's very bad or everyone's very good for borderline personality disorder. Now, here there is one thing which is very interesting, is that usually for all the disorders, you would want to give the patient CBT, and that is true for the case of borderline too. However, there is a specific type of cognitive behavioral therapy that you want to use for patients with borderline personality disorder, and that is dialectic behavioral therapy. It's a part of CBT and it's very effective against borderline personality disorder. One more thing is that these patients will be very suicidal. They would have at least one or two attempts when they're presented. Next, we have histrionic personality disorder. Now, these can easily be like confused. So, histrionic personality disorder and narcissistic personality disorder. Both of them love this attention seeking. So you see it here, and also a sense of entitlement. Or okay, yeah, this would be much better. So constant admiration. Now, there's a couple of differences here. That patients who have narcissistic personality disorder would usually be envious of others, and they would usually be very defensive. They'll be very enraged, or they would actively try to bring people down to prove that they are better. On the other hand, patients with histrionic personality disorder, they'll usually be very, okay, a flamboyant is a good word. So they would wear like very bright clothes and draw as much attention to them as possible. And the reason why they do this is not for any kind of appreciation from people. They so yeah, not the same driving factors as narcissistic personality disorder, but more just because they like to express themselves. And the last cluster, which is anxious or worried, is avoidant personality disorder, OCPD, and dependent. Now, avoidant personality disorder, usually similar, not similar, but like we already discussed, the difference between paranoid and sorry, schizoid and avoidant disorder, where avoidant people are also very alone, and additional to that, they're also very fearful of rejection. Here, this is a very good way to put it. They're hypersensitive to rejection. Now, the reason why they're hypersensitive to rejection, just to you know say it again, is that these people. Sorry. Yeah. The reason why these people are very hypersensitive to rejection is because, or hypersensitive to rejection, and also why they're alone, is because these patients they're very afraid of rejection, and they usually think that whenever they act in public or they speak to anyone in public, those people will actively criticize them after the interaction. That's for avoidant personality disorder. Next, we have obsessive compulsive personality disorder. Now, this is very similar to OCD. A majority of this is similar to OCD. There's only one difference, major one, which is ego syntonic versus ego dystonic. That means patients with OCD know that something is wrong with them. So let's say someone has a phobia of germs. So whenever they touch a non-sanitized surface, they'll go wash their hands. And the patient actively knows that this is bad and that they want to change this, but they cannot. On the other hand, let's say someone with obsessive compulsive personality disorder, when they touch a surface which is not sanitized, they would go wash their hands, and they'll reason that one is normally supposed to do this because, like, if you touch any surface which is not sanitized, your hands will get dirty, and that's why you need to wash them. So for them, they don't think that it is a problem. They think that it's the logical thing to do, and other people are not doing it because they're illogical. So that's what ego syntonic means. That the patient does not see a problem with their own, I'll say, behavior. And this is actually true for all of these. So this is actually true for all of these personality disorders. All of these are ego syntonic. That means patients do not know what the problem is. They feel like there is no problem. Next, we have dependent personality disorder. Now, patients with dependent personality disorder, usually they'll be very clingy. And so much so that sometimes these patients would not be able to live on their own without the support of another person. Now, it doesn't always have to be, let's say, a significant other. Sometimes it can also be parents. Sometimes it can also be friends. But the dependence is what's important here. That they're dependent on someone for, I wouldn't say very basic life necessities, but a majority of their life. So they would be very dependent on someone. So, any questions with these personality disorders?
So while
Dr.
solving
Tamaki,
questions, it sometimes mixes up.
Yeah. So, because this is an important topic, So we will start some questions. I just realized that yesterday we had